our next guest, you will know why all this is in English. I believe that about 98% of this room will be capable of understanding German, same as in the audience, but we have a lot of participation from startups from all over Europe, and that's why we decided already early on that English is our go-to language, because English is the startup language. Everybody in the ecosystem will first try and talk in English. Sometimes it's a bit weird, but that's the case. Now, I would like to have Alexis Kouros on stage, and you're actually from Finland, right?
Yeah.
Then use your 3 minutes wisely. I know that the Finns are not usually talking a lot. That's the stereotype. You will prove us wrong.
Hello. My name is Alexis, and I represent Vital Signs. Vital Signs actually is a collaborative research project between Aalto University, Helsinki University Hospital, Helsinki University itself, and Metropolia. It's based on 20 years of deep research and 3 years of implementation research in these institutions. I'm a medical doctor myself with 30 years of experience, and one of the problems or issues that doctors, many of you agree, is that you have a limited time per patient, especially in the primary health care, and you have to do several examinations for each patient. One of this auscultation is still very important, and it's very error prone. It's statistically done for 60% of patients in primary health care because they come for cardiovascular or respiratory problems. And the tool used for this is 200 years old. Actually, the stethoscope was invented in the 1800s, and the newest development, Dr. Littman's stethoscope, which many of us still use, was developed in the 60s. Now, with all this information, all this technology, doctors, a lot of doctors, almost every doctor uses this Littman's analog stethoscope. We are going to change that. We are going to bring the stethoscope to the digital age and AI age. The device we are developing actually not only detects and records body sounds like heart sounds, respiratory sounds, and other places that the stethoscope is used, but it also has sensors for oxygen saturation, temperature, ECG, heart rate, respiratory phase, calculates blood pressure and heart rate variability, and uses AI to analyze each of these signals separately, and then a multi-signal analysis of all of these. And this is just a tool, but there is also a lot of information around. So we thought, why stop here? So we are connecting the same AI to many other sources of information, including the patient records. So previous lab results, previous diagnosis, medication is picked up from the patient database. The device has an ambient microphone which detects keywords from patient-doctor interview and uses the negative, positive sentiment to realize that if there is pain or no pain or what other symptoms are there. And it uses the so-called digital disease detection sources. I don't know how many of you are familiar with this new term, which means any information available from reliable sources about the epidemiology and demography of diseases and so on. And the results are presented to the doctor as a word cloud. So it's just one glance. The doctor doesn't need to go through tables and numbers to see what the result was. This is our prototype, which already does simultaneous measurements of all of this. We are doing a clinical trial with 200 patients. The market is this, and we need 3 million euros, please. If you collect, each of you like 100,000 will be there. So this is our team, and we have an impressive list of mentors and advisors.
Awesome.
Thank you.
Thank you, Alexis.